Hello, and welcome to Lit Fitness. My name is Christopher, and I'm a doctor of physical therapy. Today we're going to be talking about foot anatomy and how it relates to plantar fasciitis. Symptoms with plantar fasciitis are typically pain along the underside of the foot that comes from the heel and can go in towards the middle part of the foot. Most of the time people report the pain is at worst in the mornings when they're first getting out of bed and putting weight and pressure through their foot, or when they're doing some sort of physical activity where it shoots some pain into that mid part of their foot. We'll start our anatomy by looking at the bones. So the first part of the bones that we'll look at are what make up our lower leg. We have two of them there. One is our primary shin bone that we feel, and that's our tibia. And then we have our fibula, which sits along the outside of it and forms the outer part of our ankle. Those go down and connect to a bone called our talus, which sits between our heel bone, or our calcaneus, and our shin bone. That little bone there is responsible for sliding a little bit forwards or a little bit backwards as we point or flex our toes up and down. It helps us be able to transfer the force from our calf down into our foot. Then we have our calcaneus, or our heel bone, which is one of the primary bones that our plantar fascia connects to on the bottom of our foot. As we move forwards from the heel down towards the toes, we've got bones in our midfoot, and then we've got some longer bones that then attach to our toes. And those are the ones that we'll kind of focus on here as we go along, because there's some smaller muscles that attach all through that region that we need to help strengthen and support our foot to prevent some pain from plantar fasciitis. The next part of the anatomy we'll look at are the muscles that make up our lower leg and work their way down into the foot. So primarily our ankle works in a motion to point our toes and bring our toes up and down in the air. So this helps every time we take a step and we push off and we walk, from our calf that connects on the upper part of our lower leg and goes down to the back of our heel. You can feel this muscle. It's the primary muscle we think of with the calf, and they go into our Achilles tendon, and you can feel where that attaches right on the back part of your heel. This is great because it allows us to run and jump and do all sorts of athletic and explosive moves. However, every time that muscle pulls on the heel, it puts pressure through the plantar fascia. And if the muscles that we're going to talk about here next aren't strong enough to help support that, then we end up with some pain and some irritation on that plantar fascia. So as we move along our way down into the foot, we can see a couple tendons coming from the outside of our ankle and the inside of our ankle that wrap around and help support the arch and that mid part of the foot where I mentioned all of those bones are working their way down towards our toes. Then if we go one layer deeper, we can see where we have a bunch of smaller muscles, which we call the intrinsic foot muscles, that make up the softer parts of our feet. And these are the ones that we're really going to work to strengthen to help support that plantar fascia. The last bit of anatomy that I will point out, which is the most important one and the only reason you're watching this video, is the plantar fascia. So again, you can see where it attaches on the bottom part of the heel and works its way in a few different bands out to right where the toes are going to start. So these few bands that work their way from the heel out towards the toes are great when they're properly functioning and they're not irritated and they're working together with the rest of our foot to translate the force from our calf down into our foot so we can do any sort of athletic or even just regular run-of-the-mill daily activities without causing an increase in pain. Our path to success with plantar fasciitis is attacking things from the foot and working our way up the chain. So I always start my people in the clinic who I'm treating for plantar fasciitis with a few different exercises, and we'll talk about those next. The first is any sort of exercise to help strengthen the smaller muscles inside the foot, again to provide that support and strength the foot needs and take the pressure off of our plantar fascia. The next most important set of exercises we'll do are some calf stretching exercises to prevent the calf from being too tight and applying too much force to the plantar fascia all the time. The first exercise that I'll show you in this video are what I call towel scrunches, where you can easily just lay a towel down. You can have bare feet, socks, whatever. If you want to just use your socks on the floor and not use a towel, that's fine too. But I like to use the towel just so there's a little bit of feedback that you're doing the right motion. And you're going to set a timer for 2 minutes. 2 minutes is all the longer you need to do this one for right now. and you're going to use your toes to try and curl the towel up and bunch it up underneath the arch of your foot. This will help to strengthen, again, some of those smaller foot intrinsic muscles. The next exercise that works great is what I call arch doming, or short foot standing. So here you can try it seated first, and if that's easy, then we can try it standing. What you're going to do is keep your foot flat on the ground, but try to raise your arch up. When I try this one, I always feel like I'm trying to pull the front part of my foot down where we talked about where that plantar fascia attaches towards my heel, like I'm trying to make my foot physically shorter. You'll also see your arch kind of raise up there a little bit as you get everything to kind of shrink up and get the right activation of that. Do this about 30 times, hold for a good 5-second hold with each one to really get those muscles to work. You'll start to feel maybe a cramp in your foot if it's working right, or you may just feel like it's getting a little bit tired, which is fine with that as well. And the last easy exercise to add in at home to start to get some of your pain from plantar fasciitis to go away is a simple calf stretch. Our body likes longer duration stretches, so I typically start people with a stretch somewhere around the 2-minute mark and then increase it from there as their tolerance to the stretch improves. I like it with the doorway here because you can help to hold yourself up and you don't get as tired if you're doing like an awkward runner stretch where you're lunged forward the whole time. This one's nice because you can just stand there and hold the stretch for that 2 minutes to start as well. So there are 3 easy exercises that you can implement starting right now if you want. Take 8 minutes and go work on these couple of exercises. Try and keep consistent with it. If you can do them daily over the next few weeks, you should see a pretty good improvement in the pain that you're having from plantar fasciitis. It always works out well too to use your thumbs or like a frozen water bottle to kind of massage out the bottom of your foot. I'm also partial to using a lacrosse ball because they're very firm rubber and you can get a real good push and grind on the bottom of your foot with using a lacrosse ball to massage it out. Same thing, start with a couple minutes at a time. And once again, try this daily. And again, it should only take you 10 minutes max, but it should be enough to help slowly get things to head back in the right direction so you're not having as much pain from your plantar fasciitis. If you have any questions about what you should try next, please feel free to drop a comment below and I'm happy to respond and help give you some suggestions. But for now, try out these exercises and see how things go. If this is helpful, also leave that in the comments too. It'll help other people find this video and see that what you've been doing is also beneficial. So thank you for watching. I appreciate it and we'll see you on the next one.